We have a test, we call it the 4-disc test. I had a slide, but I took it out for the sake of time. We were quite right. In fact, the most sensitive test for ESBLs is to use more than one substrate. So we have an augmentin disc in the middle. You've probably seen these sort of pictures, which produces clavulanic acid. That's all we're interested in it for. And then we have a cefotaxime, a ceftazidime, and then we also have a cefpirone disc. The reason being that in some E. coli, if they've got an AMP-C there, you may mask the appearance and the discovery of the ESBL. Not always, but very often. And because cefpirone, as I explained at the end of the talk, is stable to AMP-C, it can then be destroyed by the ESBL and be in turn protected by the clavulanic acid. That sounds complicated, but you need a drug which is not, which has to be stable to it to detect it, because otherwise what you see is the AMP-C will just grow, AMP-C producer will grow everywhere and you see no zones of inhibition, whereas with cefpirone, once you've protected it from the ESBL, okay, it'll then show the enhancement even though there's an AMP-C there. When you came to you mentioned this very good question as well, what do we do about saying this is an AMP-C and that's not? Well, clinically we're really simple because we want to be quick, because if I don't give an answer in 24 or at the most 48 hours to my clinical colleagues, then it's irrelevant. You know, if I come back with an answer 4 days later, who cares? The patient's either alive or dead. So what we do is we do the cefpodoxime screening test, okay, which tells us if it's resistant, it's probably going to be an AMP-C or an ESBL. We do this first line. So on a blood culture isolate, we would do that directly on the positive blood culture. So we have a result maybe 12, 18 hours after the blood culture signaled positive. And then we put a cefoxetine disc on, which again was mentioned in the first presentation, because cefoxetine is stable to AMP-C. So if it's a pure AMP-C producer, it will be cefoxetine resistant, okay? But not resistant to cefpodoxime. And when we put it in the SBL test, it'll still be cefoxetine resistant. So our 4-disc test we put up has a cefoxetine disc as well. That's why it's a 4-disc test. So we don't do lots of fancy tests. We don't do those disc approximation tests, you know, when you take a small amount of the colony and lyse it and put it next to a cefoxetine disc on a lawn of E. coli. We don't actually do that. We haven't got the time or the money, because what matters really is empirically telling the clinicians a good answer that helps them guide therapy. So very good point. Thank you for making that.